Can barely contain my enthusiasm, and thanks so much for checking in. Today I just left clinic and we helped, the Centeno-Schultz clinic helped another youth avoid ACL surgery. That's a home run, and today I want to share that with you. We're going to go over what is an ACL, what is its function, what is ACL surgery and why you want to avoid it, and how to do it. So thanks for checking in. What in the world is the anterior cruciate ligament? It is a critical stabilizer in the knee, otherwise known as ACL. So for depiction here, this is looking straight on. This is looking from the side. This is your thigh bone. This is your shin bone. This is your kneecap. And you're looking straight down into it, and you can see this little ligament deep. This is called the anterior cruciate ligament. And if you watch Sunday football or Sunday soccer, you understand this is a game changer. So the anterior cruciate ligament is a key stabilizer in the knee. It's critical for performance and function. And it's depicted right here. So here is the thigh bone. Here is the shin bone. And it goes across like this. And there are all sorts of tears, but this patient, we'll just call her KG. KG was skiing. That's right, just skiing a year ago, went down a little bunny run, twisted, and popped. She felt this immediate swelling, and sure enough, she had a complete tear of her ACL. She went to the surgeon, and he said, you know, there's not a lot of choices other than surgery. So let's take a deep dive into what surgery means. So what it essentially means is this is the anterior cruciate. It means we are going to take a pair of scissors. That's right, scissors. Otherwise a scalpel. We're going to just cut this rascal out. So it's gone. And you only have a couple choices. You can take a tendon graft and put it here. A tendon from the quadriceps or the patellar tendon. Or you can get a cadaver, someone that's already passed to another life, and you can use that. And what they do is then they bolt it into this and into this bone. So it's not a ligament anymore. It's actually a graft if they use it from a tendon. And there's some real important complications that I want you all to know that are rarely discussed. Number one, this graft is nowhere as strong as the is nowhere as strong as the ligament you were born with. So it's susceptible to re-tears. Would you be surprised if a large percentage of the ACL grafts that are performed actually re-tear in the first 2 years? It's a fact. Number two, this is a key stabilizer of the knee. And despite surgeons' best intentions, sometimes they over-tighten it and sometimes they put it into loose, which creates instability. So tell your 13-year-old rising soccer star that wants to go to an Ivy League that she's going to have knee instability after this surgery, and it won't go so well at dinner. And then there's some really important fibers in the actual anterior cruciate ligament that tell you about balance. So performance in many patients is significantly diminished. And then the one that's not talked about is if you tighten it too much or if it's too loose, you're at risk for developing arthritis. And that's truly a sad day in clinic when you have to tell a 30-year-old woman who had ACL surgery in her youth that she has full thickness cartilage loss. And then the fifth one is it doesn't grow. The 13-year-old patient that I worked with and had the pleasure and honor was going to continue to grow. Well, this graft doesn't grow with the patient. So as she grows, either the growth of this joint is going to be retarded or slowed, or the graft itself is going to be torn. So how do you avoid ACL surgery? You utilize the stem cell advanced approach that we use here at the Centeno-Schultz Clinic. We've mastered this. We have multiple peer publications, and we've treated thousands of patients. It utilizes your own stem cells, your own healing cells that are injected into the area of tear. And KG is our most recent success story. So she was a 13-year-old who had a complete tear, whose family was wise enough to say, no, we're not going to do surgery. We're not going to do surgery because the graft has an increased risk of tear. There's probable instability after the surgery. Her performance ultimately, and maybe her scholarship, would be compromised. She's at risk for arthritis, and as she grows, the graft won't. So if you or a loved one has sustained an injury, please give them this presentation. Give us the number, give them the website. Our website is rich in information, testimonials, MRIs before and after. You don't need ACL surgery for the majority of tears. If you found this helpful, please subscribe. This is Dr. Schultz at the Centeno-Schultz Clinic, giving you just another clinical update in January of 2021. Thanks so much.